eating twice as much in terms of quantity during pregnancy or in preparation for pregnancy is very dangerous. I ain't trying to tell you what to do, but try to play it cool. Really, I ain't playing by your rules. Everything look better with a view. Why you always in a mood? So I'm acting brand new. But if you're thinking about getting pregnant, it's important to know that there are some food nutrients that are very, very essential. Now, we are not going to be looking at every food nutrient or vitamin that you should take, but I want to highlight these few because they are crucial in pregnancy, just this few. And it's important to know that a woman who is pregnant with one child, okay, you have just one child in your pregnancy, the American College of Obstetricians and Gynecologists recommend that you have an addition of 340 calories per day. All right, and before you start 340, that's a huge lot. So I'm going to take this, I'm going to take that, I'm going to take this. Let me just cut you short by letting you know that 340 calories per day can be gotten just by a glass of milk and half a sandwich. All right, don't take a huge sandwich and then cut into half, and then your half sandwich is like two or three other sandwiches of some other person. All right, so it does make a regular sandwich, half of that, and a cup of milk suffices for that 340. Now, if they were twins, you get 600 increase, 600 calorie increase per day, and if they were triplets, 900 calories increase per day. But then, talking about the necessary vitamins and minerals, let's just look at this few. And the first that we'll be looking at is folic acid. I know you've heard of folic acid. This is actually vitamin B9. And vitamin B9, we are not looking at other forms because there are other forms of vitamin B9, but we are specifically looking at folic acid. This is very important, vital for the formation of the neural tube or the brain and the spine of the baby. And if you want to avoid holes and spaces in the brain and the spine of the baby, it's very important to take sufficiently the amount of folic acid that you need in pregnancy and even before pregnancy. Now, the WHO encourages that you take 400 micrograms of folic acid every day for 1 month into pregnancy and within the first trimester, the first 3 months, and then 3 months after delivery. All right. But then if you have a history in your family of babies born with that birth defect, the neural tube defect, that is having those holes in the brain or in the spinal cord of the baby, you have to begin folic acid intake from 3 months. 3 months before you get pregnant. So 3 months to the time when you hope to get pregnant, you begin to get folic acid at least 3 months. And you get that into pregnancy. And then 3 months after pregnancy, you still keep on taking it. So generally, your daily requirement is 600 micrograms. And then because it's difficult to get all these 600 micrograms in food, and which type of foods are we looking at? We are looking at cereals, we are looking at protein foods like meat, all right, meat, chicken, yeah, you can get it in chicken, you can get it in vegetables, you can get it in legumes, you can get it in nuts and seeds, and you can definitely get supplements of this. This is very essential. And because sometimes it's difficult to actually get everything, the 600 micrograms that you need daily in food, it is recommended that you take a supplement, all right, a supplement of 400 micrograms each day, 1 month to pregnancy, and then the first trimester, and then 3 months after pregnancy, or 3 months at least to pregnancy, and then the same thing follows. All right, that is for people who have the possibility of having a baby with a neural tube defect, or have had that history in their family. All right, that is folic acid. Another that we need a mineral this time is iron. And iron is taken with vitamin C, because vitamin C that you can get in fruits like oranges, they enable iron absorption, and iron helps to replenish the body of red blood cells. The woman as a whole, she has about, just the woman as an individual can do with 18 milligrams of iron, but then when she gets pregnant, she needs 27 milligrams of iron. So it is very important that she pays good, good proper attention to her nutrition so that she can get this. If not, she might be down in red blood cells, and red blood cells work a whole lot in the woman and then the baby. Remember, there are two of you, so you are getting iron for both of you. And calcium, not least, it is not least of all of this. Calcium is very important in bone formation and bone structuring, even in the development of that baby implantation. Okay, very important. And you need, if you are 18 years of age and less as a woman who is planning to get pregnant or are already pregnant, you need about 1,300 milligrams of calcium daily. But then if you are 19 years and above, all right, you need 1,000 milligrams of calcium, all right, and above. And we are looking at foods like milk, okay, milk, cheese, yogurt. These are primary sources rich with calcium. This is very important. And not like we have named everything, but I'll conclude with water. Enable to take 2 liters of water at least every day. 2 liters of water you're drinking each day. And if your activity in the day requires that you take more, please do take more, but at least 2 liters of water in a day. And because it causes you to frequent the toilet or the urina from time to time, it might be advised that you take this earlier in the day or in the morning so that you can pee out through the day and then you have a restful night at night. Except that you are willing to wake up at every time. However, you need the water. You so need the water. Water is necessary to avoid dehydration. Dehydration for you, dehydration for the baby. Water also serves in filling up the amniotic fluid in the baby that serves to like absorb shock, okay, and keep the baby warm, regulating, all right, regulating the baby's temperature in there, all right, so that even if you're taking hot water, it does not get to the baby. Like some people have the misconception that you take hot water, it's going to heat up the baby. You take cold water, it's going to freeze down the baby. No, amniotic fluid serves the purpose of regulating the temperature of the baby. It also has antibodies in there that fight infection, keeping the baby safe. All right, so water is very important. Even without pregnancy, water is so important, diluting the body, filtering the body of a lot of wastes that will cause ill health and unnecessary expenditure that you could just treat. All right, if you have come down with urinary tract infection as a woman or a pregnant woman, you would understand what I mean. Many times we have encouraged them in a hospital, just take water. When we see a level of urinary tract infection, they drink water consistently and come back in the next visit and urinary tract infection is cleared. Do I have a witness? All right, so this actually works. Now, various bodies like the WHO, the American College of Obstetricians and Gynecologists, they advise that you get this supplements or nutrients and vitamins 1 month to pregnancy or 3 months to pregnancy if your baby is in danger, the pregnancy is in danger of various defects. But then this is what my best pregnancy experience says. With respect to good nutrition altogether, make it a lifestyle. Make it a lifestyle. Now there is this tendency of you want to wait till, okay, now I'm about getting pregnant, or sometimes I'm pregnant now, so I have to be conscious about what I eat. I have to make sure that I don't eat this, I have to make sure I don't eat that because it's going to hamper or harm the baby. But then there is a trick right there, because you can build an addiction, especially with drinks. All right, especially with drinks, to the point where it will be difficult stopping it. Okay, how easy has it been stopping some things, some food types, and some drinks that you used to take before pregnancy? All right, how easy has that been? So it is sometimes some people get so frustrated, they try to work on that regime of taking good food because of the pregnancy, and at a point they get so exhausted, they are like, something will kill a man. Like my friend will say, something will definitely kill a man, and if this is what is going to kill me, I will die someday. So I could very well die today. Well, you must prioritize your pregnancy, you must prioritize the health of that child, and you must make sure that what you do is healthy, not just for yourself, but for that child at your welcome. And even after breastfeeding, even after you've weaned the baby of breast milk, good nutrition still helps you, because you've heard of aging. All right, there are certain food types that will increase aging, okay, will precipitate aging, because you're not feeding properly. But then when you take food types that consist of antioxidants, and when you're looking at antioxidants, you're looking at antioxidants like vitamin A, vitamin C, vitamin E. They slow down aging. All right, they slow down aging. And don't you just want to age with grace, like fine wine? So good nutrition pays off, not just for pregnancy, not just for your child, but gives you a graceful aging period and process. All right, so that we are not dying in our primes, but we are able to live out fully and enjoy the things that we are working to achieve. All right, or you have already achieved right now. And aside from yourself, going back to the trick of wanting to wait till you're pregnant, till you get pregnant, or you miss your period before you start paying attention to good nutrition. That is very risky, and this is the reason. Children form in the womb, and the peak time of formation or development is within the first month and on to the second month, the earlier part of the second month of development in the womb. And some women don't even know within that time period that they are pregnant. No signs show forth. There is no belly bump at that time. And so many people discover way into pregnancy that they are pregnant, way into pregnancy. And I know of a woman who realized at 5 months of pregnancy for her first time that she was pregnant. That is that is real. It has happened. And imagine you were waiting to know that you were pregnant to eat properly. All right. You can imagine what harm you have already exposed the baby to, birth defects and all whatnot, when you have waited for all that while. Okay, past the first month peak period of formation and development, the second month, the third month, and way into pregnancy before you realize that you are pregnant. So my best pregnancy experience still advises a lifestyle approach to good nutrition is best for you and for your baby. And I know some people are saying enough with this. All right, our parents before us, they never really adhered to all these things. They never even went to the hospital until they were ill. And sometimes when they were ill, they had a way to treat themselves with local, traditional, or natural herbs. All right, just getting one herb and the other, combining it, preparing it in a particular way, and they are fine. They never showed up at the hospital. They barely even came for deliveries. No antenatal follow-ups. All right, and that is true. Worked for them. I might even be talking to some of you right now who have had minimal antenatal clinic follow-ups, all right, and minimal assistance during delivery. Probably you even delivered out of a hospital. That is not recommended, all right. That is not recommended. However, uh, you might be able to look at that and say, but what about that? Okay, I did not do any follow up. I am fine. My child even outsmarts many of those children that came through the hospital. All right. To such people, I have two two phrases for you. The first phrase came from one gyne ops that I work with, a gynecologist I work with sometimes by privilege, and I he said this, and I'll paraphrase it because I cannot say it exactly. He says it way better and cooler than I could ever. He says that let the simplicity of a matter not mask its complexity. All right. The wisdom is sufficient for the wise. Wisdom is profitable actually for the wise. Place a lifestyle approach is best for you. And it's good. Some people might also ask the question, are supplements necessary? All these supplements that we are encouraged to take from time to time, are they absolutely necessary? And I have one friend of mine in mind right now who says she is not going in for supplements because she does not see the need. She is just going to eat healthy, and that will do. And yes, it's true. Eating healthy is good. And our parents did. They had just vegetables, fruits, roots of trees, and bulbs, and all the natural organic food, and that's what they had, and they outlive us even currently. All right. I even know of four guys, four young men, impressive men. They were actually caught as captives and taken to a foreign land where they were going to serve the king of the land of their captivity. And they were selected, these four young men were selected amongst other men to undergo a probation period for a while, and during which they will be trained to serve the king. And part of the preparation during that probationary period was that they were going to be fed good food, rich food. I'm talking good food from a king's table. You can imagine what that entails. All food groups in their right quantities, every type of delicacy cooked with royalty. I mean, the best wine, not just any kind of wine that intoxicates. I mean, the best wine choices right there for them. But then, this would have been the best part. I love food. I love good food. And this to me would have been the best part of this whole probation period. All right. Eating. I mean, say less about the others. Sign me up for the eating part. This would have been the best. And the record of this is in Daniel chapter 1. Daniel chapter 1, verse 3 to 16. All right. You can read that for yourself and you would see what I'm saying. And these four young men walk up to the man who is in charge of this probation period and preparing these young men that have been chosen to be trained to serve the king. These four young men walk up to this man in charge and they say, we don't want to eat from the king's table. We would rather that you prepare us vegetables. Give us vegetables for 10 days. And after the 10 days, evaluate us. And if you see that we are not well fed enough to serve the king, do with us as you please. You can imagine 10 days, 1 week, 3 days of eating just vegetables, plain vegetables, nothing else. What significant difference will be felt after 10 days? However, the man in charge said, okay, let's see. You go, and after 10 days, I definitely will be mailing you. The people are going to come back, and whatever you're saying, I don't understand. And they are given vegetables for 10 days. And after 10 days, these four young men are evaluated to be better fit and healthy and preferred to the other men that were eating all forms of rich delicacies from the king's table. And you can imagine the effect of 10 days of vegetables, just vegetables. All right. Now, that is not the central truth of that story, because the story is actually talking about choosing to dedicate yourself and not defiling yourself with food offered to idols, sacrificed to idols. Because what happened is that the food on the king's table was usually sacrificed to idols. They will pray over it before these men ate. So these young guys, these four men, decided that they were not going to eat that food because of that, and because vegetable, the normal plain vegetable, would not be will not undergo the routine process of sacrifice and prayers and all the concoctions. They said, let us have that. But then don't minimize the effect of vegetables. There's a reason why they asked for that. Vegetables. And yes, food is very important and it is rich. When you eat good food, you can most probably do well as an individual. But when it comes to pregnancy, again, remember we are building a system not just for one person but for the other, and you're not eating twice as much, but you're eating twice as much in terms of quality, not quantity. So when I say you're not eating twice as much, I'm talking about quantity, all right? Twice as much as you used to when you were without the pregnancy, okay? But you're eating twice as much in terms of quality because of that baby. All that is needed, and what you used to have from good nutrition cannot carry yourself and the baby. So it is very essential to take these food nutrients, and we are not supplements rather, and we are not sidelining the vegetarians, all right? They are vegetarians who are strict vegetarians. They can still make up with this, all right? They can still make up with good nutrition if they are intentional, all right? And it is even more recommended that you get plant source for these vitamins and nutrients. All of them, plant-based vitamins and nutrients are recommended over animal-based. For instance, plant source of vitamin A is beta carotene, while the animal source is retinol. All right, beta carotene is preferred over retinol because retinol stored up in excess in the body will cause vitamin A intoxicity, or vitamin A toxicity rather. All right, so excess of retinol in the body will cause toxicity and can lead to birth defects, can lead to defects in the baby, defects in the development of the baby, and even in the mother. All right, while excesses, like if you go to extreme excesses of storing beta carotene in the body, the most it could do is temporal yellowish or pale skin coloration on the mother, and that is all. No harm to the baby, or little harm. All right, so plant-based as a source of these nutrients is by far preferred to animal-based. All right, so vegetarians can very well make the mark. They just have to pay attention to the proportions of the various food classes and food groups and nutrients that are needed during pregnancy. The only caveat or caution here is I'd advise you to wash your vegetables well, all right? Wash your fruits well, wash your vegetables well, and prepare what you have to prepare very well, because you don't want bacteria like salmonella and listeria especially joining your dinner or your lunch or your wonderful meal that you have prepared. This bacteria can cause right from minimal effects like headache, nausea, vomiting, right over to miscarriages. Okay, so it's very important that you prepare this very well before you take them in. So that is what we had for eating for two, all right, with respect to the woman. But you remember we said that the man also eats for two, right? And in the next video, soon to be launched, all right, soon to be posted, we will be talking about how the man's one-time contribution is very, very crucial in pregnancy. So I advise you to stay put, and we will be putting that up for you very soon. Thank you.